Medi-Cal unwinding the special public health emergency protections for Medi-Cal enrollment. Will you be affected? Hi, I'm Kevin Knaus with InsureMeKevin.com. And the parent agency that oversees Medi-Cal, the Department of Healthcare Services, has released a fairly comprehensive document on how their plan on how to unwind all of the special protections for Medi-Cal beneficiaries that were put in place during the pandemic, the COVID-19 pandemic. And the big one was continuous coverage, and that no one would be terminated because they failed to supply documentation for their annual redetermination period. The document states that currently there are 14.5 million people in California in some sort of Medi-Cal healthcare program. So obviously, if the public health emergency were to end on July 15th, that would be a crush of people. But they do have a plan, and it's been signed off by the Department of Health and Human Services on how to move everyone through. But essentially, they need to redetermine everyone's eligibility. And the public health emergency looks like it's set to end July 15th, but they're hoping, Department of Healthcare Services hoping, that there might be another 60 days granted. However, even when it does end, you are not going to be thrown off of Medi-Cal. Again, there is a whole blueprint of how they're going to go through and redetermine eligibility. First, what's going to happen is that they're going to take your annual redetermination month, and that's really when they're going to do it. So, for example, if your redetermination month was in January of 2023, you would be receiving the renewal packet at the beginning of November. And that would give you time to fill it out and then get it back to them. So they're going to be staggering all the people through the program, and it won't be a crush. You don't have to worry about just being thrown off of Medi-Cal. Now, Medi-Cal has been working, and if your income does go up and you report that and you request, you can be terminated from Medi-Cal and then go into covered California with the subsidies. But the big aspect of the pandemic and the emergency regulations was continuous coverage. So there was a lot of people that have coverage that may not be eligible for the Medi-Cal program right now, but they're not going to be penalized. Okay, that's something else to remember. When the redetermination period comes up, that's when Medi-Cal will look at the eligibility. And they will be doing some other enhancements with the electronic income verification to kind of smooth some of the process through to help everything go as best as possible. Because again, there's 14.5 million people that they need to take through the whole redetermination period, and it's going to be staggered throughout the year. So to allay many people's fears, when the public health emergency finally ends, no one is going to be immediately terminated from Medi-Cal. There is a whole process and a plan that is being put in place. Department of Healthcare Services did identify one population that may be adversely affected, and that is people who turned 65 during the public health emergency and just maintained Medi-Cal coverage because it wasn't terminated. They had continuous coverage, but they missed their Medi-Cal enrollment date. And the rules with Medicare can be really kind of goofy with special election periods and initial election periods. But there is the possibility that if they are redetermined that they are not eligible for Medi-Cal because they're 65 and other issues, but they can't enroll in Medi-Cal Medicare, that may leave a gap in coverage. So they are looking to potentially redetermine all of those people in a December timeframe to alert them that their Medi-Cal will be ending, but that gives them time to apply for Medicare during an open enrollment period in January. And they're also looking at potentially, hopefully implementing some special enrollment periods for some of the Medicare beneficiaries to make that transition. Another aspect that will be happening between Medi-Cal and Covered California is that in July, they're hoping to have everything in place so that if someone is terminated from Medi-Cal, they will just automatically be segued into a Covered California health plan with the appropriate subsidy. And that would provide continuous coverage, and people won't, be, what do I do next? They would be in Covered California with a health plan, and sometimes that health plan may be zero cost to them, depending on their income level. But what we do need to keep prominent is that if someone is enrolled into a Covered California health plan and there is a premium, they need to make that first month's premium. Otherwise, the health plan does not become effective. So there's going to be need to be a little bit more education and reaching out to some of those people that have been terminated from Medi-Cal after they've been redetermined that they're not eligible. They've been put into a Covered California plan, maybe in 2022 or 2023, and that they need to make that first month's premium. Some of the expanded services that Medi-Cal put in place during the public health emergency will continue, such as telehealth. That's where you can call a doctor on the phone or do a video conferencing and get a consultation with a doctor. That expanded use will be in play in certain situations. Medi-Cal is still looking at how to make it effective and efficacious. They don't want health plans leaning on telehealth and discouraging face-to-face visits, which can be very, very important. Certain providers during the public health emergency were able to prescribe things that they couldn't before, and that will remain in place, such as some providers being able to prescribe non-emergency medical transportation, home health services, durable medical equipment, physical and speech therapies, and prosthetics. The reimbursement rates for some of the healthcare services and equipment will be maintained at 100% of Medicare rates, and that's going to be applying to clinical laboratory services, COVID-19 vaccine administration, and oxygen and respiratory durable medical equipment. There will be specific drug and rehabilitative services that were expanded that will stay in place that really focused on individual counseling and substance abuse counseling and crisis intervention, treatment and discharge planning. So again, something that was kind of expanded during the public health emergency. They found out that it's good, it works. They're going to be continuing that. Along with the telehealth on the HIV/AIDS program, they're going to be keeping, some of the conferencing in place in terms of the regular assessments, and so we don't have to do face-to-face when it's not needed. And so those were many of the waivers to enhance care during the public health emergency that Medi-Cal was able to get that will stay in place. But the big thing that most people are concerned about is the continuous coverage. And of course, that is going to be phased out. And of course, Medi-Cal is looking to resume normal operations, which means, you have to do the annual redetermination for the eligibility and supply the documents for that. But it's going to be okay. No one's just going to be automatically kicked off of Medi-Cal. What the Department of Healthcare Services has said is that they do believe 2 to 3 million people will lose Medi-Cal, but a large chunk of those people is because they have lost contact with them. Because, Medi-Cal sends out notices, and if the mail is returned undeliverable, they don't know where the person's at and they can't contact them. So if you are in Medi-Cal and you have moved, contact your local social services agency that handles Medi-Cal and update your address. It's very, very important, because if you're not getting the annual redetermination notices, you can't supply Medi-Cal with the necessary paperwork, and then your coverage could be canceled. So it's going to be okay as the public health emergency ends. We just have to, stay educated and stay on top of it. Thank you so much for your time. If you have any questions or comments, you may leave them below. I'm Kevin Knaus with InsureMeKevin.com.